Welcome to this presentation on free intra-abdominal air. This is really sort of a crude first attempt. Hopefully we'll be uploading a better attempt in the future at looking at this problem. But for now I just want to have something up there for you guys to look at so that you can recognize the findings, the etiology, and a couple of pitfalls of free intra-abdominal air. But again, hopefully we'll have a more extensive presentation available for you guys later. So what does free intra-abdominal air look like? On this diagram, hopefully it's clear to you that the most frequent finding with free intra-abdominal air, especially or almost exclusively on an upright radiograph, is going to be air beneath the right hemidiaphragm and the liver. Normally those two soft tissue density structures are opposed, and you're not going to be able to see air there unless you have an abnormal air collection there, usually because of a perforation of a hollow viscus. But you can have other etiologies. People who are, for example, on peritoneal dialysis may have this finding, or people who've had recent surgery or abdominal instrumentation. So this is what free air looks like classically on a radiograph, and you can see beneath the right hemidiaphragm and between the right hemidiaphragm and the liver, you can see an abnormal lucent collection, and that represents air. Again, going back to what we've talked about before, there are four basic radiographic densities, and you've got an abnormal radiographic density living where normally you should have soft tissue density. So that's some free intra-abdominal air in this particular individual. And this is what it might look like on a CT scan. You have an axial image on the left and a coronal reformatted image, and again it just shows that there's air, this low density stuff, this black material between the right hemidiaphragm and the liver. This example here is a little more subtle. Again though, we've got some air beneath the right hemidiaphragm, between the right hemidiaphragm and the liver. Now notice that this is an erect chest x-ray. It says erect there just above the left shoulder. So what happens when people are in the erect position is that the air goes up to the diaphragm. Now you may have a much different finding when you have people who are in a supine position. The air is going to collect in a different place. It's going to collect anteriorly as opposed to up underneath the hemidiaphragms. So this is an example here of a supine radiograph on an individual who has free intra-abdominal air, and you don't see anything here. In fact, very frequently it's easy to miss the diagnosis of free intra-abdominal air when you only have a supine radiograph. That's why we pretty much routinely in these individuals end up getting an upright radiograph as well, because it's much easier to see the air between the diaphragm and the liver. That's not to say though that there aren't findings that you can see in patients who are supine who have free intra-abdominal air. We're going to talk about one of those signs. This is known as Wriggler's sign. So you have a normal radiograph there on the left, and you have an abnormal radiograph with free intra-abdominal air on the right. And let's see if we can distinguish what the difference is between those two radiographs. Now normally you can only see the inner wall of the bowel, because basically the bowel is going to be a soft tissue density, and you're going to, if you have air on the inside of the bowel, you'll be able to see the inside wall of the bowel, as illustrated on the right with the arrow. Normally you do not see the outside of the bowel wall. On the left, on the normal radiograph, you can see the inside of the bowel wall, but you cannot see the outside of the bowel wall. Let's go ahead and add another arrow showing the outside of the bowel wall. Why can you see the outside of the bowel here? Because you've got air in the peritoneal space. And this is known as Wriggler's sign. So normally you can only see the inner wall of the bowel. If you can see both the inner and the outer wall of the bowel, that's because you've got air both inside and outside the bowel. And obviously that's going to be a finding that is diagnostic of free intra-abdominal air. Now why is that? On the left is supposed to be a loop of bowel with air only in the bowel and no air outside the bowel. So basically the only place where you're going to have air is going to be inside the bowel. Outside the bowel you're going to have nothing but soft tissue density. On the right is supposed to be a schematic of what air both inside and outside the bowel wall looks like. So that's supposed to be a length of bowel there, and you can see inside the walls of the bowel there's air, the black stuff, and on the outside of the bowel there's also black material, in other words air. So you'll be able to see both the inner wall of the bowel and the outer wall of the bowel in somebody who has free intra-abdominal air. And this is just a particularly dramatic CT scan with coronal reformatting there on the left, showing air both inside and outside the bowel wall. Somebody with a very gross example of a Wriggler's sign, and you can see that there's gross evidence of free air both on the plane radiograph and on the axial CT scan. Okay, one last pitfall. Occasionally you can see air between the right hemidiaphragm and the liver, and it may not necessarily be free intra-abdominal air. It looks like I've sort of made a string of sausages there along the or beneath the right hemidiaphragm. And basically what this is supposed to show is that occasionally we can have colon that'll get caught between the right hemidiaphragm and the liver. That's known as colonic interposition. And one of the ways that you can distinguish that from free intra-abdominal air is that colon, of course, has an anatomy, and I've sort of drawn it very crudely here to look like a string of sausages, but basically you can see the normal bowel markings in an individual who has colonic interposition. So here we have an example. We've got air beneath the right hemidiaphragm, beneath the liver and the right hemidiaphragm, but you can see that this air has structure. It looks like colon. It's got those haustral markings that go partially across the bowel. So this person has colonic interposition. They do not have free intra-abdominal air. So that's one of the pitfalls that we want to avoid. This ends our presentation on free intra-abdominal air. Thank you very much.